thing I want to And another thing I want to ask is that if you haven't already done so, please go ahead and mute yourself. There's quite a few of us on this presentation, so we just want to try to limit any excessive background noise during the presentation if possible. Now, as far as you guys turning on your video camera or not, that's up to you. You can or you don't have to, so I'll leave that up to you guys. And then the last thing I want to talk about real quick is that if you guys have any questions throughout this presentation, there is a chat option here in Zoom. If you will, just type any questions or comments, concerns, anything in that chat portion. I will do my very best to try to pay attention to that as well throughout this presentation, and I may stop and address a question or a comment during the presentation, or I may wait and just kind of try to go back through some of those questions at the end of the presentation. We'll just kind of see how everything's going. Okay, so let's get started. Okay, so let's start off first of all by talking about what COVID-19 is and what are coronaviruses, okay? So we know that coronaviruses are a large family of viruses. Now, they do cause illness in people. We do know that they've been present for a long time, and they do cause illness in people. However, there are specifically coronaviruses that only infect animals. Rarely these animal coronaviruses that infect animals have emerged and infect people as well, and that's what we're dealing with right now. There are, like I said, already some coronaviruses that are present in the US that cause upper respiratory symptoms like runny nose, and there are some that cause more serious illnesses. Now, this specific coronavirus that is present in the world right now that we've identified as COVID-19, we do know that it may have originated in animals and jumped to humans. It is specifically called a beta coronavirus, which just means that it may have originated in bats. Now, some other examples of coronaviruses, which you may have heard of in the past, are MERS, which stands for Middle East Respiratory Syndrome, and SARS, which is Severe Acute Respiratory Syndrome. Now, COVID-19, that's just the specific name that's given to this coronavirus, like I said. And you also may have heard of it, referred to it as SARS-CoV-2. So that and COVID-19, they're the same thing. And as we all know, I'm sure you've heard about this a lot. You know, we do know that the epicenter of this outbreak has been identified as Wuhan, China. They think it originated there in a large seafood and live animal market. Okay, so now we're going to jump in to talking about, I want to go ahead and talk about some common terms or definitions you guys may have heard of throughout all of this. I think a lot of these terms and definitions can seem kind of confusing at times. So I just want to talk about those from right off the bat. So the first one is community spread. So community spread just means that people have been infected with the virus in an area, and in some of these individuals, we can't identify exactly where or how they were infected. So we can't find a link to their infection to a known person who has been identified as sick or positive for COVID-19, and that person was around them. So that's an obvious link. But community spread occurs when there is no obvious link to people getting sick with illnesses. Something important, and I will probably mention this a lot throughout the presentation, but community spread is happening within the state of North Carolina as well as various other states across the country. So let's move on to the second topic, or the second term, is self-isolation. Self-isolation and self-quarantine, I think people have been getting a little bit confused, so let's talk about those real quick. So self-isolation refers to an individual or individuals that are confirmed positive for COVID-19, or they're suspected of COVID-19, and maybe they have a test pending, or if they have very strong symptoms of the disease. So self-isolation refers to those people that are isolated away from others to protect and prevent against the spread. Those that go under self-isolation are deemed healthy enough to recover at home. And these people should remain in isolation away from others that are not infected until they receive clearance from their medical providers. So that's something important to remember. Now, self-quarantine, this means the separation of people, a person or group of people that may have been exposed to an illness, but they don't have symptoms yet. So again, it's important to self-quarantine people or recommend self-quarantine in individuals to prevent the possible spread while we're waiting to see how those individuals recover or what their symptoms do. So currently, you guys may have heard, the current recommendation for self-quarantine is a minimum of 14 days as in reference to COVID-19. And discontinuing self-quarantine as well needs to be done at the direction of a healthcare provider. All right, next slide. So these are also a couple more terms I'm going to go ahead and go over real quick. So congregate settings. Congregate settings just refers to crowded public places that where close contact may occur. So you guys know this, a congregate setting is the campus, is Wingate University, shopping centers, movie theaters, stadiums, churches. These are all areas known as congregate settings. It's important that we avoid these areas because this allows the virus to spread more easily and more rapidly to a large number of people, okay? And then the last term I want to go over real quick is social distancing. We've also heard about this a lot. This is talked about a lot, but this is, again, kind of related to congregate settings. You want to remain outside of those settings, avoid gatherings of more than 10 people right now. And social distancing specifically means staying at least 6 feet apart from others when possible. Okay, we're going to move on and jump in. Okay, so now we're talking about, let's go ahead and talk about symptoms of COVID-19. Now, we've heard probably, you guys may have, I don't know how closely you're watching the news, but there's a lot of talk about various symptoms and what patients experience when they have COVID-19. Now, we do know that symptoms typically appear after 2 to 14 days after exposure to the virus. And the most common symptoms that we know patients have, and that as providers that we want to screen for, are fever, cough, and shortness of breath. Now, however, as we move on, you guys will see in some of these other slides, we'll talk about more symptoms, but there is a huge spectrum of symptoms related to COVID-19. Everything, it ranges from no symptoms at all, very mild symptoms, to severe illness, respiratory distress, and even death, unfortunately. Okay, so again, we're going to talk more about these symptoms here. So like I said, there's a huge spectrum of symptoms that we've learned over time that patients can experience. There's also, we've developed a list of what we consider emergency symptoms or emergency warning signs for COVID-19, where as a provider, this is when I'm going to tell the patient that they need to not wait and immediately seek in-person medical care. And I've listed those there for you. It's trouble breathing, persistent pain or pressure in the chest, new confusion, or if you're unable to awaken or arouse a person, if they're becoming very lethargic, and then if they have a bluish tint to their lips or face. Now, the biggest thing to remember with these symptoms is that this list is not all inclusive. So anytime right now, if you guys are experiencing any concerning symptoms, any cough, any fever, sore throat, congestion, anything you're concerned about that is atypical for you, I recommend that you consult your medical provider, call that office and talk to them and let them know what you're experiencing. Call the health center, talk to us, let us know what's going on. Now, other symptoms patients have reported and we found in individuals positive for COVID-19 are flu-like symptoms. So that can range from, fatigue and body aches that we know is very common in the flu. But even we've actually found that patients with COVID-19 have reported a decreased sense of smell. And we found that about half of all patients positive for COVID-19 have also had GI symptoms. So GI symptoms means they've had nausea, vomiting, diarrhea. So, I've just identified a ton of different symptoms, that could be associated with flu, allergies, sinus infections, stomach viruses. So as a patient, it can be very confusing and overwhelming to know that there is a broad spectrum for symptoms, and even as providers when we're assessing patients. But the biggest thing I want you guys to know is if you think you've been exposed to COVID-19, if you have been around people that have tested positive, that have traveled, that are having any questionable symptoms, and then you start to develop symptoms, you definitely just need to contact a medical provider to talk to them about what you need to do and if you should seek in-person medical attention. The other thing is we're really recommending is before you go to a healthcare provider, to a clinic, to a hospital, to an emergency room, if you develop any of these warning signs on the slide, you need to call and let them know, and they will give you further instructions for how to come into the office, if you're going to need a mask, if you should wait in your car, and then they'll give you a number to call when it's time to come in. So lots of different processes are being implemented in healthcare facilities across the country. And always, if an emergency is going on, you need to call 911. Okay, so we're going to talk more about now how COVID-19 is spread. So the biggest thing we know is that COVID-19 is spread from person to person. This is the main route of transmission. We'll talk about some other routes here in just a few minutes, but person-to-person spread is what we know is number one. It most often, again, occurs between people who are in close contact with one another, so within households, within apartments, within dorms, with your roommates, people within 6 feet or less of each other. And more specifically, we know through the respiratory droplets, because this is a respiratory illness, that when an infected person coughs or sneezes, these respiratory droplets we know can land in the mouth and the noses and be inhaled into the lungs of people close by. So this is definitely number one for the way this virus is transmitted. Okay, so talking more about the spread of it. So can someone spread this virus without actually being sick and having fever, cough, shortness of breath? So we do know that for the most part, people are thought to be the most contagious when they have symptoms. So when they're sick, when they have fever, when they have cough. But there is thought that some spread of this virus is occurring in patients before they even show symptoms. So there is possibly a long time between exposure to the virus and symptom development. So that range of 2 to 14 days. So let's say a person's exposed to it and they don't start to develop symptoms until 14 days, possibly later. There is some research out there that possibly this virus has a longer incubation period than the 14 days. So it's possible that they're spreading it before they even know they have it. But we do know right now, and what we're telling everyone to stay safe and protect yourself is if you have symptoms, you've got the fever, got the cough, you need to separate yourself from others within your household to try and prevent the spread, whether it's COVID-19 that you may have before you're tested and know, or if it's just another virus, if it's the flu, anything like that. Now, there's also some evidence out there, some research being done that some individuals can spread the virus after they're considered no longer being contagious. So what that means is people, after their fever and cough has resolved, for instance, and they followed their medical provider's recommendations for, staying home for so long after symptoms stop. There has actually been some research out there that has found that people may continue to spread it even after that fever resolves. So again, this is not the main way, but it's something we need to be concerned about and be aware of so that we can help protect ourselves. Secondly, there's a big concern out there about whether or not this virus is spread from contaminated surfaces and objects. And we do know that this is true, that this can happen. It may be possible to spread coronavirus or COVID-19 by touching a surface or an object that has the virus on it. So if I coughed or sneezed into my hand, and then I went and opened a doorknob, or touched a doorknob and opened a door, and then someone came behind me and touched that doorknob and then touched their eyes or touch their nose or their mouth, then we do know that that also is how this virus can spread. Again, it's not thought to be the main way that it's spread, and we know that the most important thing to do to prevent this is for people to wash their hands frequently for at least 20 seconds with soap and water. And if that's not available, if you're out running errands or at the grocery store, you're getting back in your car, it's recommended that you use an alcohol-based hand sanitizer that's at least 60% of alcohol. And we want you to rub your hands together completely with that alcohol and keep rubbing until they're completely dry. Let's see, I'm going to pull over the chat. I think somebody just posted a question. Yeah, so if everyone can see that question that Emily just posted, if you catch it, will you definitely develop symptoms and get sick, or is it possible that you won't get symptoms? So yeah, that's within that huge spectrum that we kind of talked about a few minutes ago. So there are people that we have found that tested positive for coronavirus or COVID-19, and they felt fine. They didn't have symptoms. We do know that people are most likely to test positive for it. Once they're developing symptoms, there is a chance that if we test someone very early in after their exposure, we could actually get a false negative. But it all depends on the patient. It depends on their health history, how if they have any chronic medical problems, and everyone's body, we're finding, responds so differently to this virus. So yeah, it is very possible that people can contract this virus and have no symptoms, or have very mild symptoms and not even think anything of it. They may just think it's allergies, or maybe they have a cold. But that's why we're telling everyone, if you're having any respiratory symptoms at all, whether they're extremely mild or not, we want you to stay home and until your symptoms resolve, because there is such a broad spectrum for symptoms that people have, that's also feeding the transmission and the spread of it. Okay. So the next question that was posted, Jessica, I'm going to answer that here in a few minutes. We're going to actually get to that about whether it's important to wear a face mask. Okay. So sit tight. We'll get to that one. Okay. Moving on. So now we're going to talk about how easily, which I did kind of mention there answering that question, how easily this virus spreads, okay? So as you can see, and as we know, this is a pandemic, so it's affecting the entire world. This virus does spread very easily, and it's sustaining that spread throughout the world, and specifically now largely throughout the US. So it's demonstrating the community spread, like we talked about earlier a few slides ago when we went over our terms and definitions. Now, we do know that currently there's no vaccine to help prevent this coronavirus. And we do know the best way to prevent illness from this virus is to avoid being exposed to it. Now, there are a number of viruses or illnesses that spread very easily from person to person. For instance, very contagious diseases that spread easily other than coronavirus are the measles. And, we've heard about measles outbreaks throughout the country in the past few years and how contagious that is. And then there are other viruses that don't spread as easily. And a lot of that depends on how well the virus lives outside of the human body. Does it spread from person to person and require humans to spread, or does it spread more so it can live on inanimate objects and surfaces and doorknobs and things like that. So once community spread is exhibited in a virus, that's a concern because we're seeing that this virus, like I said earlier, is sustaining its own spread and infecting a large number of people. Another reason that this virus specifically is spreading so easily and affecting such a large number of people is the fact that this is a brand new virus to humans. We have no built up immunity against this virus, okay? So as soon as we are exposed to it, we contract the illness. Now, again, whether you have no symptoms or very severe symptoms, that just depends on the individual, but you do contract the illness. Your body doesn't just fight off this illness because we don't have any antibodies against this virus. We haven't been given a vaccine against it. We've all been vaccinated against, younger kids now are vaccinated against chickenpox. So it helps protect them from getting chickenpox, because once they're given the vaccine, they build up antibodies against the disease and it protects them. But unfortunately, with COVID-19, we do not have the antibodies against this virus. So we have no immunity. So that also plays a role in how easily it spreads and the large number of people that are affected by it. Okay, so we're gonna move on to the next one. Okay, so let's go ahead and talk about ways we can protect ourselves against this. It seems really basic. I know this slide may seem silly, but clean your hands, wash your hands often. Wash your hands for at least 20 seconds with soap and water. Use that hand sanitizer, 60% alcohol content after touching doorknobs. If you've been in the grocery store, you're driving, anytime you're coming back into your home from being out in a public area, after you've sneezed, you've coughed. This may seem very basic, very elementary, and I know we've seen this all on TV, on ads, on the radio, you hear ads about this, but this is one of the best ways to protect yourself from the virus. So wash your hands and always avoid touching your eyes, nose, and mouth as much as possible, but definitely avoid that with unwashed hands. After pumping gas, I think that's a big one. I didn't mention that earlier, but if you're at the gas station, you pump gas, get back in your car, use that hand sanitizer right then. Another thing we always recommend is when you're cleaning things, if something is visibly soiled, so if something has visible dirt on it or it looks dirty, before you can disinfect it, you really need to clean that dirt, remove that dirt from that object with soap and water, and then disinfect it. Okay, so that's what we recommend. All right. Okay. Still talking about ways to protect yourself. So avoid close contact with others, but specifically you really want to avoid close contact with people who are sick. So community spread, like I mentioned, is occurring. So that is even more of a reason to avoid close contact with others, to follow the social distancing recommendations. And this is especially important for people who are higher risk of getting very sick from this illness. And we'll talk more about that high risk category of individuals in a few slides. But since community spread is occurring, it's even more important as well for people to actually listen to the stay-at-home orders that are being put out there right now across the country, not to go out in public unless you absolutely need to. We know that usually it's older individuals and very young people that have been affected by this virus, but it's really important to follow these orders and distance yourself from others to help slow the spread of this virus and protect yourself from contracting it. Again, they're recommending no gatherings of 10 people or more, and the important thing I don't think people realize is that these things are being done to allow more time for the development of a vaccine, as well as to allow for more research to be done to help find the best medications possible to help treat the virus. As we've all been seeing on the news, our hospitals across the country are extremely overwhelmed and having a difficult time managing the number of patients that are being treated for COVID-19, as well as there's an extreme shortage of very important medical equipment that's needed to help protect those healthcare providers and provide care to these patients. So if we all follow these stay-at-home orders and we're social distancing from one another, we stay home when we're sick, we can help slow the number of people getting sick. Therefore, that will help slow the rate of hospital admissions. And when we can slow down the rate of hospital admissions, it allows our healthcare system to be able to handle the amount of patients that are coming in at a time as well. So it's all connected, and I just want you guys to understand that and just to know so that we can help prevent this. So the question that was just posted, Jose, I can't really provide a lot of information about that, about the virus being heavy. That's something I would have to research. I would go ahead and tell you guys that, you know, there's a lot of misinformation that's being spread about this virus, unfortunately. So if you hear something, even if it's put out on a newscast, unfortunately, if you hear something that you are concerned about and you want to know, hey, is that true? What should I do about this or that? I recommend sticking with your most reliable resources. And currently, what all healthcare providers, hospitals, researchers, what we're all following for treating this disease and getting up to date, the most accurate information is the CDC. So go to the CDC, go to the Department of Health and Human Services within your state. They're also a lot of times linking back to the CDC. They work very closely together. All right, so Jessica just asked about vitamin C. So that, and again, a lot of this, and I'm gonna get to a slide, I'm not sure if it's my next slide or not, but I have a slide where I talk about some questionable medications that have been in the news that has been kind of controversial, or people are talking a lot about whether these medications help with COVID-19. Vitamin C is one that was brought up. And again, that was in a very specific population that they were referring to. Now, if you want to take vitamin C, you know, it's not going to hurt you. It is a water-soluble vitamin. So, you know, if you're taking, you know, 1,000 milligrams of vitamin C a day, a lot of people like to do that in general to help boost their immune system a little bit. There's not a ton of data to support that actually, but it's not going to hurt you. We do get vitamin C from a lot of our foods that we're eating, a lot of fruits, a lot of vegetables. So if your diet doesn't involve a lot of those things, I do recommend a supplement or a multivitamin for that. But if you take more than your recommended daily allowance of vitamin C, it's water soluble, so you're just gonna urinate it out. It's just gonna come out when you urinate. So there's no risk for truly an overdose with vitamin C. But that was more so related to patients in ICUs with the vitamin C. Okay, so the heat, I'll go ahead and I'll address this question real quick. Alyssa just posted, and then I'll probably move on to the next slide. But yeah, so the question about, is the virus killed by heat? You know, that's a question that as medical providers, as researchers, we've been asking for a long time. You know, are we going to see this slow down as summer approaches? And there's some research out there that goes back and forth on this, because we have to remember that this virus is a pandemic, so it affects the entire world. And while we are in we're in spring right now in the southeastern U.S. here in North Carolina, we're in spring, the season of spring, and you know, summer is shortly coming. There are countries, you got to remember, like in South America, in the Caribbean, you know, that are extremely warm temperatures already, and they're being impacted by the coronavirus just like we are, just like China has been, just like Italy, just like Spain. So yes, there is a hope that we will see a reduction in this virus as the temperature rises and summer comes, specifically here in the US. but we can't say for sure yet. But it's it still needs more research, and truly, because this is a brand new virus and we don't know if it's going to be a seasonal virus or not. Like, we do know the flu is seasonal here in the US. However, in other parts of the country or in other parts of the world, the flu is not seasonal. So people contract it year round. We just don't know. So much of this virus we don't know because it's brand new. So we have to wait and see. Okay, moving on to the next slide. How you can protect others. And I've already said this numerous times, but it's very important. We can protect others by staying home if we're sick and by covering our coughs, our sneezes, right? Throwing away our tissues after we blow our nose, and washing our hands immediately. Stay home if you're sick, except to get medical care. Now, when I say that, I'm referring to people that are not having those emergency warning signs, okay? So anytime, no matter what, whether you think you have COVID-19, or you have the flu potentially, or just in general, you have shortness of breath, your lips are turning blue, you're losing consciousness, you're very lethargic, no matter what's going on in life, if you ever develop any of those symptoms, chest pain, chest pressure, you need to seek immediate medical attention. And again, like I said before you consider going to a doctor's office or an ER, you need to call those offices and let them know to get the best instructions. Also, limit contact with others in your household. If you're sick or having any symptoms, as best you can. That can be very hard to do. Not everyone has an excess of bedrooms that they can kind of sequester themselves from. I know I don't. So if I were to get sick, my house doesn't allow for me to go be completely isolated. I've got kids, I have a husband, so I can't it'd be very hard for me to isolate completely from my family, but that's what's recommended if you can. And then, like I said, washing those hands at least 20 seconds, soap and water at all times, okay? Okay, so now we're gonna talk about the whole face mask issue, okay? So this has been a big one. If you're sick, should you wear a face mask? If you're not sick, should you wear a face mask? Okay, so currently what's being recommended by the CDC is that if you're sick, it is recommended to wear a face mask in certain situations, okay? So you definitely should wear a face mask if you're sick and you're around other people. So if you're sharing a room with other people, if you're riding in a vehicle with other people in a close space like that, like say you're being taken to a doctor's appointment or to the ER, yeah, you should wear a face mask when you're with those people in that small space. If you're going to the doctor's office, a lot of times now they actually are having patients sometimes wait in the car and then they'll be called in at the time of their visit, or they're definitely having them put face masks on while they're sitting in the waiting room. Now, some patients feel like they can't wear a face mask. If they're having shortness of breath, trouble breathing, they feel like the face mask makes that worse. So in that instance, if you can't wear the face mask because you feel like you can't tolerate it, it's recommended just to try to stay at least 6 feet away from others and cover your coughs and sneezes. And people who actually may be around you, so if you're at home and you get really sick, but you don't need to be hospitalized or anything and you can recover at home, if you have a loved one that's coming into your room to provide you with food, with water, to give you medicine, to take care of you, they should wear a face mask if they're coming into the room as well. And the other thing to do, like I said, when you're sick, self-isolate yourself from your people within your house. Don't share household items. So don't eat or drink after others. Don't share a cup with other people. And then monitor your symptoms frequently. That's a big one. Monitor your symptoms and stay in contact with your healthcare provider. They're going to give you that updated guidance and recommendation for any changes to your care, or if they would recommend at some point that you do come in and be seen. And when to discontinue that self-isolation is another important thing. So now, specifically if you're not sick, okay, and we've seen on the news people wearing a mask when they're out in public. If they're at the grocery store, I know I've seen I've seen people when I've been grocery shopping lately, with a mask on. And as of now, the CDC does not recommend that you wear a mask if you're not sick to help protect you from getting the coronavirus, unless you're caring for someone in your household that's sick, okay? Um, Face masks, another issue, unfortunately, related to the face mask is that they are in extreme short supply. Medical equipment and supplies in general are extremely short supply. So we're really trying to save the use of these items for hospitals, for healthcare workers that are on the front lines, because unfortunately, if all of those individuals get sick, there's going to be a shortage of healthcare providers, and we aren't going to be able to provide care to people like we need to. So we've got to do our best to try to protect our healthcare providers right now as well. So no, I would say I would not recommend that you wear a mask, but things are changing daily and hourly. So always refer back to the CDC if you guys have any questions about that. Okay. So now we're getting into, this is a big slide, okay? I know this has a lot of words on it, so we'll get through it. But this is a big topic. Who should be tested? That causes a lot of concern and anxiety in patients. They want to be tested for coronavirus. But I've got a lot of important information that I want to go over with you about it. So first thing I want to say is testing recommendations for any illness like this, but specifically right now, testing recommendations for coronavirus are largely impacted by the availability of tests and testing supplies. So early in this outbreak, there were much more strict or stringent guidelines and recommendations for who should be tested due to limited testing supplies. We did not have adequate testing supplies and access to testing in our country, unfortunately, early in this outbreak. And that's something the country's been working hard on fixing. And a lot of it's also been dependent upon what state you live in. So different states have had different amounts of testing supplies and things like that. So a couple things. So patients can be tested for the coronavirus either through the North Carolina, in our state, so through the North Carolina Department of Health and Human Services at a state testing lab, or through commercial testing. So commercial labs, commercial testing is done typically by your healthcare provider. So if your healthcare provider, they can actually order commercial testing or testing through the state lab. So your healthcare provider would determine which option to do. You guys wouldn't have any say necessarily which option or which lab you were tested through, okay? However, a big thing, and you guys may know this if you've talked to any of your doctors, your primary care doctors, or if you've been sick and you've called to try and schedule an appointment. Most every medical provider and medical office in the country has switched to providing care through telehealth options and virtual health. So doing like virtual health visits or Zoom visits, essentially. Now, they've done this to help prevent the spread of coronavirus to healthy individuals and to healthcare workers in their office. And they're actually recommending that if patients have mild respiratory symptoms, even if they do have fever and cough that could be suspicious for coronavirus, they're actually recommending, though, that these patients, if they're not high risk, they're not having shortness of breath, that they just stay home and they isolate from others until their symptoms resolve. And even if they would have further symptoms like cough or like fever, body aches, congestion, they're really recommending that. They're limiting the amount of patients coming into their offices. And I'm not sure if you guys have spoken with me or someone else at the health center, but this is also how we've adjusted our care. We're doing the bulk of our care to telehealth now. So if you guys have questions, concerns, you're sick, you need to talk to a medical provider, and you guys want to call us, you can. But we are going to provide your care through telehealth or virtual visits. Furthermore, about this, the reason this is going on like I said, is to, there's more risk of spreading coronavirus when you bring a patient in for testing that is low risk to have complications or that's not having those severe illnesses. So like I said, if you're shortness of breath or high risk category, that's when your provider would probably have a more in-depth conversation with you and would maybe consider ordering a test for you to be tested for coronavirus. And there are different options for that as well. There are actually, you may have heard of different drive-up testing sites that are popping up across the country. If any of you guys are local, somewhat local to Wingate, there is a drive-up testing site actually in Concord, North Carolina at the ZMAX racetrack at Charlotte Motor Speedway. That is a testing drive-up site now. So you do, though, have to have an order from your primary care provider. So, or from a provider, not necessarily primary care. So that is something that your provider could talk to you over the phone, and if they felt like it was recommended, then they could order it and send you to one of these drive-up sites. Some offices are even testing patients. They're having them stay in their car, and they're going out to that patient's car when they arrive, and they're swabbing them for this, and then letting the patient leave. Again, keeping people out of the office. So that's a lot to consider. Now, you see on this slide, I'm not sure if you guys have read over this yet, but this slide, this is the most up-to-date recommendations by the CDC for recommending testing for coronavirus. And you see it's broken down into priority 1, priority 2, priority 3, and then a non-priority. Typically, we're not going to test people that don't have symptoms. And yes, we did talk about that sometimes people have been shown to have coronavirus and not have symptoms. Unfortunately, right now, they're considered a non-priority, and most providers, I can't tell you any that I've spoken with, would actually recommend testing someone just to see if they have it, if they have no symptoms. So that priority 1 patient or priority 1 patients are any hospitalized patients are going to be tested. So if they're having that shortness of breath, difficulty breathing, severe enough they need to be hospitalized, they're going to be tested for coronavirus. They're also probably going to be tested for other viruses like flu to rule out that to make sure flu is not causing their symptoms as well. And then any symptomatic healthcare workers, like I mentioned earlier, they're a priority. We've got to keep our healthcare workers safe and healthy. And if they contract this, we've got to get them better so they can get back out there to help take care of people. Priority 2 patients that we would more likely consider testing, again, anyone that's 65 or older that has symptoms, long-term care facilities, so people that may live in nursing homes, long-term care facilities like that have symptoms, because those areas are very, they spread the virus very quickly because it's a large group of people in a small area. So the virus can spread very quickly. So we would more likely test patients there. And then anyone that's got underlying conditions. And we'll go over those in a minute. And first responders, so firefighters, EMS workers, those people, again, we need them to be healthy so they can help take care of people right now. So if they're having symptoms, they're going to be a priority to be tested. And then I'll just let you guys read over those other ones, but it's just good information for you to have. And you can find this information on the CDC. And let's see, someone typed something here. Spraying Lysol on surfaces or clothes, does that help? So yes, things like that, Lysol, products like that, that can disinfect. And I believe might be our next slide talks about couple slides. So we're 2 slides away. So in 2 slides, I'll talk to you guys about how to clean, disinfect, what products to use and things like that. But yes, that can definitely help. Okay. So, whoops, sorry guys, I got ahead of myself there. Okay, how is COVID-19, how is it treated? Okay, so COVID-19 or coronavirus, it's a virus, right? And it's a brand new virus. There currently is no specific treatment for it. I've put on the slide a few things you can do to help relieve your symptoms. If you do test positive for COVID-19, or if you're just being told to stay home and self-treat because you're a low-risk patient and you're not having warning signs. So taking pain medication, fever medications, and just treating your symptoms, drinking plenty of liquids, washing your hands a lot, staying home, resting, and staying in contact with your medical provider, and monitoring your symptoms throughout that time. So the biggest thing I always like to talk with patients about, whether we're talking about coronavirus or the flu or other illnesses that we contract routinely that are caused by viruses, is that you need to remember or understand that a virus means that it's not caused by a bacteria, okay? So viruses cannot be treated with antibiotics, and we don't recommend using antibiotics to treat a virus. They will not respond because they're not bacteria. Antibiotics are only meant to kill bacterial infections. So what do we say then? Most every viral illness basically has to run its course. So it has to run its course through your body. Viral illnesses, for let's say other upper respiratory illnesses, typically live in your body for 7 to 10 days. Things like that, and we recommend treating your illness symptomatically. So whatever symptoms you have, you treat that. So for instance, if you're coughing, take a cough medicine. If you're congested, take a decongestant. If you have a fever, take Tylenol, things like that. So that's what is still being recommended at this time for COVID-19, is just to treat your symptoms. Like I've mentioned earlier, there's a lot of research going on for medications and clinical trials to find meds, antiviral medications, potentially that could help treat COVID-19 or help shorten the course of illness and stop the replication of the virus in our body. There's a medication that we all know called Tamiflu, and this is done, or we use Tamiflu oftentimes in people that test positive for the flu or have flu-like symptoms, because Tamiflu helps to stop the viral replication in our body and shorten the course of illness from the flu by about 12 to 24 hours. So that type of research is being done for COVID-19. Now, you guys may have heard, you were asking me earlier about, vitamin C, because that has been in the news a little bit. But you also may have heard of a big medication lately that's been a hot topic called hydroxychloroquine or chloroquine. The name brand for this medicine is Plaquenil. This is an anti-malarial drug typically, but it's also very frequently used to treat a lot of autoimmune diseases here in the US and across the world. But there has been a lot in the news about whether that medication, in combination actually with azithromycin, which is an antibiotic, surprisingly, if it's effective at treating COVID-19. Now, you may have also seen on the news that some healthcare facilities, some healthcare providers have been ordering this medication in bulk, and there's a shortage for this now in our country, which is unfortunate because a lot of people rely on this medicine every day for a lot of chronic medical conditions. But what we all need to understand is, just because one research article came out about a medicine that may be effective, or scientists may have seen some improvement, that does not mean that there's enough evidence to show that it truly does work or that it truly is effective. So at this time, there is not enough evidence to show that Plaquenil or azithromycin alone or in combination help with COVID-19. So that is, I don't want to say misinformation, but people often take a small piece of information and run with it, unfortunately. So you really need to make sure you're getting your information from reliable resources. Another interesting fact I wanted you guys to know is there has actually been good evidence showing that the use of acetaminophen or Tylenol is actually better and recommended to treat body aches and fever in patients with COVID-19 or with suspected COVID-19 versus using NSAIDs. So NSAIDs are medicines like ibuprofen, Aleve, Advil. So that's good to know, and some good interesting information as well. And then some other information that I want you guys to know that's been a big one that we've been, as providers, been paying attention to is there's been some good research showing that they're not recommending you take acetaminophen or fever-reducing medications unless absolutely necessary. Now, the reason behind this is that our body's natural immune response, or our natural response to help fight illness and protect ourselves, is to develop a fever. So fever isn't necessarily a bad thing, okay? Your body's doing this to try to fight off illness and develop antibodies. What happens when you develop a fever and you're fighting a virus or an illness, your body often develops antibodies against that virus. And those antibodies down the road will protect you against developing that virus again. So many researchers have been saying that with COVID-19, don't immediately jump to taking fever-reducing medications like Tylenol if you develop a fever, unless you are, I always tell patients, unless you can't tolerate the fever, or there's also a line where you don't want the fever to get too high to where it's dangerous and could cause febrile seizures. So that's just a seizure that happens when a fever is too high. So I would say, I tell patients that number where it's a medical emergency for your fever is 105. If you develop a fever of 105, you should seek medical care after taking a fever-reducing agent. So if it's 105, you take some Tylenol, and then you need to call a medical provider or go to the ER, okay? But if you can at all avoid it, they're actually saying having that fever to help fight COVID-19 is a good thing. And we all need to remember that it's actually a normal, natural response within our body. Okay, sorry, I know I was talking a lot. Someone typed, so let me see. So Jessica, I'm reading about your cleaning business. So again, I mean, if you're having to go back and forth to work right now, just doing the best you can to still implement the recommendations for social distancing. So even if you have to be in an office and maybe there's 3 of you guys in the office, if you can at all, separate yourself. So with your cleaning business, if you guys are going into a building together and cleaning, try to stay at least, 6 feet away from each other. Some businesses, people that have businesses that travel, they're now riding in separate cars. They're not riding in the same car anymore to carpool to their locations they're going to prevent being in too close of contact. When you say, I'm not sure what facilities you're referring to, if you're cleaning healthcare offices like doctor's offices, or if you're cleaning businesses, there are, if you are cleaning like medical offices, doctor's offices, I would say you definitely want to wear gloves while you're cleaning and dispose of those gloves. Wash your hands as soon as you take them off. Don't touch your face, your eyes, your nose, your mouth if you're cleaning with those gloves on. And just be very, I would say, cautious with the people you're working with. If anyone's developing any questionable symptoms, and even if it may be just allergies, because right now the pollen count is so high in our area, so a lot of people are struggling with allergies, but it's hard to tell oftentimes what it could be. I would just say be very cautious about having people coming to work with any symptoms, any respiratory symptoms, cough, congestion. Definitely if they develop fever and cough, I would tell them they need to stay home until those symptoms resolve, and at least 3 days after those symptoms resolve. So let's see, Alyssa just typed something as well. Is it true you shouldn't take Advil or ibuprofen? Okay, so yeah, so sorry if I didn't clarify that well. So yeah, so the research actually that I was talking about as far as acetaminophen, the Tylenol, that yes, they are actually recommending the use of acetaminophen or Tylenol. Tylenol is just the name brand. So you can buy generic acetaminophen, Walmart brand, Food Lion brand, CVS brand, whatever, as long as it says acetaminophen on the bottle, that's Tylenol. And that's what's recommended right now over NSAIDs. Again, this is a lot of, because this virus is so new, a lot of the research and information we're getting is coming out a lot more quickly than it typically would be on something we've seen for a few years or a disease that's been around longer. But because of the gravity of the situation, a lot of our research that's being done is being done at a faster pace. But the use of acetaminophen is one that's considered a reliable source or reliable information. So yes, I am telling patients, I'm telling my family and my friends, you know, to use acetaminophen if they have fever, if they have body aches, if they are concerned if they may have COVID-19 but they're staying home to recover, versus the NSAIDs like ibuprofen, Advil, Aleve, naproxen, anything like that. And yes, the reason being is because of the where NSAIDs actually do kind of work in our body. I'm trying to keep it very basic, but yes, where it goes to work in our body, or the site of how the NSAIDs are broken down and processed basically throughout your body, it can actually worsen the course of illness with COVID-19 if we use those potentially. So stick with acetaminophen as one of the recommendations right now. Okay, so we're gonna make sure we're moving on here. Okay, sorry, looks like I went backwards when I clicked that, guys. Or no? Yes, okay. All right, so now we're at the point where we're gonna talk about like a few of those helpful tips. I know we've already talked a lot about wash hands, wash hands, wash hands. So guys, can't beat that into our heads enough, right? So we gotta wash our hands. But clean and disinfect all those surfaces Loki talked about: doorknobs, light switches, countertops, handles, desks. Phones are a big one. We're on our phones all the time. You've got to clean and disinfect your phone. We're working from our laptops 99% of the time, right? You guys are doing school on your laptops. We're all working remotely a lot and in the office. So make sure that you're wiping down these laptops and desktops. Now, I went ahead and put, if you guys see that link on this slide, that link or that URL address, if you go there, that is a list of EPA, the Environmental Protection Agency, the EPA approved list of cleaning items or cleansers that are known to kill COVID-19, okay, kill that coronavirus. So you can go there and get a list of appropriate cleansers to make sure that you're using items within your home to kill the virus and protect against it spreading. Another thing they're actually saying with your laundry, it's recommended that we wash our laundry in the warmest water setting possible. I know that depends on what you're washing. You don't want to shrink things. However, wash the laundry on the warmest water setting possible and dry it as well on as high of heat setting as possible to help kill anything on our clothes as well. So we'll move on to the next one. Okay, so now I've got us into a lot of frequently asked questions or just things that have come up related to this virus and people want to know. So a big question has been about, can you get this virus when you open up your mail, when you open up a package? We're all doing a lot of online ordering nowadays, and you know, items can come from overseas or they can just come now from here within the US, right? So since coronavirus is so widespread, people have been very concerned and at times not opening packages with concerns of getting coronavirus. So currently, there is no evidence to support the transmission of COVID-19 from imported goods from China and from other parts of the country. And there have not been any cases of COVID-19 in the US associated with shipped goods. Now, like I've said already, there's a lot that's still unknown about this virus and how it spreads, but we do know that it is very genetically similar to SARS and MERS. Now, while we don't know for sure that this virus is going to behave the same way as SARS and MERS, we are using the information, the knowledge we know from these coronaviruses to guide us. So we know in general that, this virus has poor survivability, so it doesn't survive very well on surfaces. There is likely a low risk of spreading it whenever you open products and packages in the mail, okay? But there has been a lot of testing done on this, okay? So they've taken the virus and put it on items like cardboard, plastic, copper, and they've seen how long the virus lives on these surfaces, okay? Because this has been a concern with everyone opening stuff. I know I'm ordering things online a lot right now. So we do know that this virus does require humans to survive, but if someone coughs on their hands, sneezes onto a cardboard box, it can live on that cardboard box, but for a very short period of time. And we know that typically if it's being shipped, the likelihood of that package being kept at a temperature that will consistently sustain that virus and keep it alive over the period of shipment is extremely rare. So the best recommendation we're telling everyone is just to wash your hands after you're touching packages, after you're opening boxes, after you're opening the mail, okay, just to help to decrease any likelihood of that and protect yourself. Okay, next question or next slide. This is one I've talked about. Who is at higher risk for serious illness, okay, from COVID-19? So we have identified that people at highest risk to have more severe symptoms and poor outcomes, such as death from COVID-19, are older adults. So that's anyone 65 and older. And in some cases, we've actually identified they've dropped that number down to age 60 and older. People who live in nursing homes or long-term care facilities, people who have serious underlying medical conditions like heart disease, hypertension, diabetes, lung diseases like COPD and asthma, and then anyone who is immunodeficient or immunocompromised. And these are typically people that have autoimmune diseases like, for instance, RA, rheumatoid arthritis, psoriatic arthritis, lupus. And the reason being is that people with autoimmune diseases, yes, they are typically immunocompromised. Their immune system doesn't work like it should. And then on top of that, they're often taking medicines that weaken their immune system. So that's why these individuals are at higher risk. And then another interesting, I don't know if it's interesting, but another fact we've actually found is that men actually tend to be more negatively impacted by COVID-19 than women. Now, the exact reason for this is unknown, but a lot of research is being done on that. Okay, and then now we are at this last, I believe this may be yes. So this is our last slide, but is a vaccine available? So I mentioned it earlier, but no, currently there is no vaccine to protect against COVID-19. The development of a vaccine is underway. We are actually already in a phase 1 clinical trial for a vaccine against COVID-19, which is a pretty big deal. The development of vaccines actually take a very long time, but we know that we are about 12 to 18 months out from having a vaccine that we may be able to circulate through population and provide to patients to help protect against COVID-19. Okay, so like I said, that was my last slide for the presentation. I'm gonna go ahead, I've got a couple quick little questions I wanted to run through with you guys, like polling questions, if you guys don't mind answering them for me. And we'll just go through this really quick. I would say maybe during this polling time, if you guys had any last thoughts or questions, you type them in the group chat and I'll try to glance at that after we're done with polls, okay? Okay, so here is your first question. I'll give you guys a few seconds. Again, these are pretty basic, but just want to see what you guys picked up on from the presentation, and we'll talk about them real quick. All right, I think everybody's about answered here. All right, I'm gonna go ahead and end that poll, okay, so we can get through these. All right, so I'm not sure if you guys can see the results on that. Oh, here, I'm gonna share them now. Okay, so as you can see, about 50 people answered, so about everyone answered, but yes. So those are all things you can do to protect against COVID-19. All right, so I'm gonna go to the next one. If I can get it to do that. There we go. Okay, question 2, true or false? The best way to prevent illness from COVID-19 is to avoid being exposed. All right, a few more seconds here. All right. So yes, that is true. We do know the best way to prevent illness with COVID-19 is to avoid being exposed to the virus. All right, question number 3. True or false? COVID-19 is now demonstrating signs of community spread in North Carolina. All right, a few more seconds and then I'll end this one. We'll share these results. Okay. So yes, that is true. We are experiencing community spread. Okay. Got 3 more questions real quick. True or false? Wearing a mask, even if you are not sick, will help protect you against COVID-19.
I think false.
So yeah, this question is a little bit of both, right? So I'll go ahead and talk about it while you guys are answering, let y'all finish up, and then we'll talk about this one because it's a little interesting here. I'll give everybody maybe 10 more seconds, then we'll talk about it. Okay, so let's share our results. Let's see what everyone put. So this one's kind of, I mean, it's tricky, but I mean, it's not tricky, but so what we recommend at this point and what the CDC recommends, right, is if you are not sick, if you do not have symptoms, respiratory symptoms, that we do not recommend, like you go to the grocery store with a mask on, right? Now, that may change, but at this time, we don't recommend you wearing that. Now, obviously, there is some protective quality, right? Because if you're taking care of a family member, for instance, that has COVID-19 or that has upper respiratory symptoms, and you're just trying to be extremely cautious and you have to go into the same room as them, you know, you can put a mask on. So there may be some positive or some benefit associated to that. However, the false is also correct, I would say, because there's no definitive evidence against it, especially when we're discussing just basic medical masks. Now, there are medical masks known as like N95 respirators, if you've heard of those. They've, I believe, been talked about on the news as well, but like healthcare providers that are taking care of COVID-19 patients, or they're testing patients that may have COVID-19, or in general, if anyone that's coming in with suspicious symptoms, healthcare providers are wearing the N95 respirators, because those are made specifically to prevent the transmission or prevent illness, to prevent illness from being transmitted to not sick people. So this was a little bit of a tricky question, so I apologize for that, guys, but I'm interested to see what you guys said. Okay, so we're gonna go on to the next one. Two more, okay? All right. True or false, is it recommended that everyone be tested for COVID-19, even people who have no symptoms? And this one also could be a little tricky, but in general, I'd say. Give you guys about 10 to 15 seconds and we'll talk about it. Okay. Okay, so I would definitely lean more towards saying that the false is right now with the situation in the world with our CDC recommendations. False is more so the correct answer. And the reason being is that if you guys remember our slide on this, it said at the bottom that people with no symptoms are kind of that last priority, the lowest priority for testing. Now, I know that probably still brings a concern for people, because if there are people out there with no symptoms at all, you know, no fever, no cough, nothing, but potentially they have the virus. However, at this point, we do not typically recommend testing people without symptoms. So it is more so recommended for people with symptoms or that fall into that high risk category or hospitalized and such. A lot of this too, like we talked about, depends on how the ease of access to testing supplies and sites, and how many how much testing material your state you reside in have, like what your state has. So yeah, at this point, we do not recommend though testing people with no symptoms, okay? Okay, and then last question. True or false? True or false, you should avoid opening packages in the mail or packages that have shipped from China to decrease your risk of contracting COVID-19. Oh, you can't see it? Sorry, guys. Let me see. I'll try again. Can you see it now? Oh, yep, you can. Sorry about that. All right. Go ahead and we'll end it here. Okay, so yeah, false is what I would consider the correct answer here. So, you know, like I mentioned, the survivability of the coronavirus on packages is extremely low. The likelihood that it would survive through shipping and all the temperature changes and the length of time that it takes to ship a package and things like that further decreases the likelihood that the virus would survive. It's not going to be kept in a perfect environment for survivability. So, and like we should anyway, even if this wasn't going on, you know, you should always wash your hands after you open packages or open the mail. So that's correct there. Okay, so while you guys were answering, all these polls. I was watching you in the group chat, so y'all posted some good comments here. I don't know if you guys want me to touch on what was posted about how are things expected to get better if we're 12 to 18 months out. And then I love the response too that you guys are giving each other. That's great. So, you know, typically what we're also hoping and what scientists have discussed is by slowing the spread of the virus, if we're all limiting our contact with others, if we're staying away from others when we're sick, but also by slowing the spread of the virus, and then also essentially this may sound, I don't know if this will sound bad, but by allowing people to actually become infected by the virus, once a certain proportion of the population becomes infected by a virus, there is something that can become established called herd immunity. And once herd immunity is established, that helps to protect the spread of a virus, because a large number of people have become infected. They're now immune to an illness, a virus, and you know, for instance, those of us that are old like me, that we did not get the chickenpox vaccine when we were younger. We just got chickenpox. That was normal for people of my generation. So, you know, now that I've had chickenpox, I cannot get chickenpox again. Now I can get, not chickenpox, but I can get shingles, right? Shingles is similar virus, it comes from, doesn't come from the chickenpox virus, but that is typically what people can develop secondarily or later in life after they've had chickenpox as a child. But I typically won't get chickenpox again. So if one of my kids, even though they've been vaccinated against chickenpox now, if they weren't vaccinated and say one of them got chickenpox, even though I was around them, taking care of them, I wouldn't get chickenpox, right? So that's another thing that's been talked a lot about, is that if a certain proportion of people in the US actually contract COVID-19, we can help slow transmission, because herd immunity essentially will have developed at that point. And then also, I'm going to make sure I'm answering everything right. Also something to think about, they're hoping with this virus, and again, we have to remember that this virus is new. We have never seen this virus before. We haven't been able to study it and see how it impacts humans and get a great understanding under how to treat it, the symptoms, prevention fully, things like that. So this is all brand new. So the information coming out is changing by the hour at times. So a lot of this that we're talking about today, you know, the information may have changed tomorrow or next week or in a month. That's why I tell you guys, you've got to make sure that you've got reliable resources and that you're checking with reliable sources like the CDC and staying up to date on things like that to limit your misinformation, because misinformation can be very dangerous for people. But from what we found so far, this virus is not mutating or changing a lot, and sometimes viruses will do that. They'll mutate, which makes it harder to essentially establish vaccines and understand how to treat them. So the other hope is if we can establish a vaccine, create a vaccine, then if for some reason, we don't know yet if this will happen, but if this coronavirus becomes now a normal part of a seasonal illness like the flu is, so we worry about flu season, are we going to have a coronavirus season, a COVID-19 season? We don't know yet. We have to wait and see. But because right now we've seen that this virus does not mutate frequently or is not mutating a lot at all, the development and likelihood that a vaccine could be successful to help protect people against it is a positive thing. So hold on, I see there's a message down here. Let me look. Okay. All right, guys, so here is just a list of the resources I've got for you. Again, stick with your most reliable resources, and this is going to be CDC and the Department of Health and Human Services. And then on this last page, Carrie, I'm not sure if you want to take over about them doing the attendance form and such that I've got here to get credit for the Lyceum.
Yep, I just posted it. So for the students to get your attendance, just go ahead and click on the same form you've been doing. Sign in with your Wingate email. And if you have problems with it, email Antonio Jefferson so that he can make sure that you have access to that form. That's your attendance form. So click on that. And thank you all for attending. And thank you, Serena, for presenting. I really appreciate you.
No problem. Thanks, guys, for listening. I know it was kind of long, but if you guys need anything, have any questions, just let us know. The health center is still open 5 days a week. Stay safe and healthy. Carrie, do you want me to sign off? Will you end the meeting?
Why don't you hang out for a few more minutes just in
Okay.
case somebody asks you a question in the chat?
Yeah.
And I think you need to end the meeting. Do you see the end the meeting
Yes,
link?
I see it
Okay,
there.
yeah. So I think since you started it, you'll need to end it.
No problem. Perfect.
Okay.